I have a question about uh, hemorrhoids and anal fissures, because you had
Hmm.
mentioned those two things, and they are two separate things. And
Yes, yes.
so I'm curious what your thoughts are. We've talked on this show about processed food and the American diet and how it relates to constipation. And I'm curious if they're in from a health education and your uh, national and international expertise in anal health, is there a relationship between what we eat and anal health?
Yeah, of course. I mean, there's a relation with what we eat and every single part of our body, right? So why wouldn't it affect that in any case? So, there hemorrhoids and anal fissures are somewhat have similarities, but they're two totally different things. So, can I just go back and explain what they are? Because some
Please,
of your okay.
please.
So, hemorrhoids are basically we have these vascular anal cushions, and everyone has them. It's part of our normal anatomy. We believe it has to help with like incontinence, I mean continence, sorry, and sensation and different things like that. And when those anal cushions get larger or expand, that's what we call like swollen hemorrhoids. And you can have different types of swollen hemorrhoids. For example, you can have external hemorrhoids or internal hemorrhoids or like everything just coming out. So there's a variety that goes in the hemorrhoidal disease. And typically what happens with hemorrhoids is that and this is a real simplification, but it has to do with straining on the toilet or sitting too long on the toilet. Anything where gravity is pulling down on the anus, it's going to make blood rush down to the hemorrhoidal tissue, and then it's going to expand. Now, whether it comes out on the outside and it becomes a thrombosed external hemorrhoid, like a blood clot on the outside, those hurt like hell and it looks like a marble on the outside, or if it's like a swollen internal hemorrhoid that usually is bleeding and you might feel some pressure but not really pain because of the anatomy, or all the hemorrhoids prolapsing out. So it could be a variety of different things. So that is from, and you don't have to be constipated to get it, but you can, like, by scrolling a lot on the toilet, which is a big problem these days, hanging out there. But that's sort of like the hemorrhoidal disease. Now there's nuances in that where collagen disorders and different things like that. So collagen and hemorrhoids and those things have to do with each other. But those are nuances. Now, for all the healthcare practitioners listening to this, please stop prescribing steroid-based ointments or creams or foams for hemorrhoidal disease. There's zero evidence for this. Where did it get started? I don't know. Who thought it would be a good idea to put steroids for this reason? It makes no logical sense, and I've looked it up. There's no data on it. And it actually makes things worse because it thins the skin. And again, people are using it for extended periods of time, and it just doesn't help. So no steroids for the anus. End of story. I mean, okay. No steroids for hemorrhoidal disease. Sorry, there are some things where you need it for. Someone's going to get a clip and be like, she said this. Um, so that's hemorrhoids. Now, fissure is a cut in the anal area, and that typically happens from anything that's stretching the anus too much. Often it's from constipation, right? And you don't have to be fully constipated. It could be just like the end of the stool, and if that end part is too large and it stretches your anus and the rest of it is loose or normal, you can still get a fissure from it. It just has to be really tiny. Or people can get it from the other direction, right? Like we were talking about, any kind of anal intercourse or anything. Basically anything stretching the anal area can give you a fissure. Now the pathophysiology with that is that it hurts. It hurts, like people describe it like shards of glass. It hurts, it bleeds at the same time, and then your anus goes into spasm. And then as your anus is spasming, and then you're afraid to go to the bathroom because you know it's going to hurt, then you tend to be constipated because you're holding it, but it's also spasming. So the treatment for that is breaking the spasm and making sure the stool is super soft, like even almost like it can't hold the form. You just want it to not stress out the anus at all. So the treatment is to relax the anus with medication, and actually like some mental relaxation helps too, as do sitz baths. Sitz baths are sitting in warm water that actually relaxes the anal area. And then making sure no one gets constipated, and also thinking back and saying, what did I do that caused this? Let me make sure not to do it again, because it could keep happening over and over again. And the thing that people get mixed up, fissures and hemorrhoids a lot, is that with a fissure, you can get at the like in a part of it where the cut is, you can get a little skin tag. And that's like from the irritation. So often people look just from the outside, they see a little skin tag, they think it's a hemorrhoid. You touch that area, it hurts because the fissure is underneath. You can't really see it, you know? And then it gets misdiagnosed as a hemorrhoid. Steroids are given. A fissure is a cut. You're putting steroids on it. What do you think that's going to do?
Owie.
So yeah, so those are the nuances, and like understanding the different thing. And the other thing I would tell all healthcare practitioners out there is that if someone is in pain, please limit the exam that you do, because you can really traumatize someone by forcing a scope. You know, part of the exam is not just looking externally and doing an exam with a finger, but it's also putting a scope in there, similar to a speculum for a vaginal exam, but it's a little different. And if you force that in there when someone has an active fissure and they're in pain, they're scared to come and see anyone else about it. So I think it's key, again, don't force the exam. If it hurts, just don't do it, and send them to someone who can actually, like, you know, do the exam or even diagnose it without an anoscope.
Sure.